The topic I'll cover this time is surgical wounds. So, surgical wounds, this is important to know so that you can understand the significance when it comes to infection risk. So, surgical wounds can be classified clean, contaminated, as well as dirty. So, there are four different classifications of surgical wounds. And based on this classification, now each of these means something. Each of these class of wounds, they mean something. And what they actually are important for is the infection risk that they predispose to, ranging from zero to something a very low risk rate, close to zero in the clean surgical wounds, up to 40% when you come towards the higher grade, which is dirty wounds, up to 40%, right? Okay, now right. So now, what is the significance? So, why is it that you need to know this? Most of the time, when you take information, you need to know the reason why you're taking it. Otherwise, there's no point in knowing that. So here, this is needed because you want to give prophylactic antibiotics. By giving prophylactic antibiotics, you're going to reduce the risk of an infection that can result, after you are doing under surgery. So, and when do you give the antibiotics? Usually 60 minutes prior to the now, clean surgeries, now you need to know what each of these things are. So, it can poses an infection risk. You want to give antibiotics to prevent that. Best time is to give 60 minutes prior to the surgery. Now, what are these wounds exactly? So, clean in the sense. Now, again, there's no kind of, like there's no entry, right, into some kind of a tract, a gastrointestinal tract, or any kind of, tract that might have contaminated matter. So the examples would be like a thyroid surgery, and orthopedic surgeries usually are clean surgery if they are closed. And these classes of surgical wounds, they don't usually need any kind of antibiotics. But some practical scenarios, sometimes they might give it, just for the sake of prophylaxis. But they don't usually need. But if you have something like if you're putting an implant in it, then that's a different story. For prosthesis or some kind of implant, you have to give some kind of antibiotics. So that is one. Right. Now, what is clean contaminated? Clean contaminated is when you are going for, you're going to approaching, it's like, for example, a cholecystectomy. You're approaching a tract in a controlled manner. Yeah, so that there is the fine example. Next one is, what do you say, contaminated. So these are usually your traumatic, wounds are usually contaminated. Traumatic, maybe stab injuries, all those are contaminated surgeries. And because they have perforation into tracts. And these usually, for even open fractures, you take open fracture, there is a Costello classification that goes from 1 to 3, and the first two are usually contaminated. So these things again need antibiotics, just like the previous ones. But treatment, usually they go towards treatment doses. Now after this, you have the dirty wounds. So dirty wounds, again, they abscess, clearly, like really contaminated fecal matter, all those things. So they need treatment, right? Clear treatment, and they pose a very high infection risk. Usually the Costello, if you look in the fractures, you've got Costello 3. And if it's just general surgical, you might think of peritonitis, fecal fecal peritonitis, right? So that's that. Yeah. So that is pretty much related towards the surgical wounds and the infection risk management and what their definitions are.